Hi, my name is Christina Felsen, and I'm the Program Manager for the Communicable Disease Surveillance and Prevention Program at the University of Rochester Medical Center's Center for Community Health and Prevention. The title of my talk is Tracking a Pandemic, Collaboration and Data Sharing are Key, and I'm going to discuss the role that the center played in our region's response to the COVID-19 pandemic. So first, a little background. COVID-19 is the disease that's caused by a virus called SARS-CoV-2. SARS stands for Severe Acute Respiratory Syndrome, and CoV stands for coronavirus. Coronaviruses are a family of viruses that are actually quite common and circulate readily in our environment, but they often cause milder disease, more like the common cold. What's different about the coronavirus that's causing the COVID-19 pandemic is that it's more virulent and more transmissible than other coronaviruses we've seen in the past. This means it more easily spreads person to person, it more easily infects people, and you're more likely to get more severely ill when infected. We call it a pandemic because of its wide geographic spread and the millions of people that have been affected worldwide. As of October 2021, there were over 221 countries affected by COVID-19 with 237 million cases. In the US alone, there's been over 43 million cases and 700,000 deaths. The pandemic evolved pretty rapidly, starting with detection of the first case in Wuhan, China in early January of 2020. A few weeks later, the first case was detected in the US in an individual that had a history of travel to Wuhan. About a month later, we started to see cases in the US among people who did not have a history of international travel. And we saw our first nursing home case and first nursing home outbreak, sadly, in a nursing home in Washington state. By March 11th of 2020, the World Health Organization had declared COVID-19 a pandemic. And a few months later, at the end of May, there were over 100,000 deaths already in the US. Fast forward to December 2020, when the first vaccine product was approved for use in the US. So where does the Center for Community Health and Prevention fit into all of this? Well, in March of 2020, we started surveillance for persons hospitalized with COVID-19 as part of the Centers for Disease Control and Prevention's Emerging Infections Program, or EIP. EIP is a national network of state health department and academic centers that conduct surveillance for diseases of public health importance. There are 14 states currently participating in COVID-19 surveillance, representing about 10% of the US population. Locally, our catchment area includes Monroe and the 6 surrounding counties, representing about 1 million persons under surveillance. So what is surveillance? It's the first step in the public health response model shown here that helps define what the problem is so that public health professionals know how to identify the populations most at risk and intervene to prevent further disease. For COVID-19 hospitalization surveillance, we're collecting data to help define the problem and understand what type of people are getting sick. So this includes collecting information like how old people are, what is their gender, and what is their race and ethnicity. We also collect information on why people are getting sick. Do they have certain underlying medical conditions that might make them more prone to illness? Or do they work or live in a healthcare facility like a hospital or nursing home that might put them at higher risk? Finally, we collect information on what happens to individuals that are hospitalized with COVID-19. How sick do they get? Do they require admission to the hospital's intensive care unit? Do they require certain medications or breathing treatments to be given? And finally, what is their outcome? Do they survive at the end of their hospitalization? And if they do they go home needing increased care and special services because they're so debilitated from COVID-19? So what do we do with all of these data? Well, as part of the EIP, we share them with CDC so that our region's data can be combined with data from the other EIP sites and can be published on CDC's website on a weekly basis. These data are publicly available and inform the nation of the current state of the COVID-19 pandemic. Data are broken down by age group, like you see on this graph here, that shows that persons aged 65 years of age and older were most affected by the COVID-19 pandemic. But there's also the opportunity to break the data down by race, ethnicity, and other characteristics so you can see which populations are most at risk. The data we contribute to EIP also goes into publications that are meant to rapidly inform the clinical community of the state of the pandemic. For example, we just contributed to two important publications, one showing the increase in hospitalizations among children and adolescents under 18 due to the spread of the Delta variant. The other compared hospitalization rates among vaccinated and unvaccinated cases, showing that unvaccinated individuals had a 17 times greater risk of being hospitalized with COVID-19 as compared to those who were fully vaccinated. Besides sharing our data with CDC, we also share data with the Monroe County Department of Public Health, healthcare facilities like hospitals and nursing homes, and several community partners like Common Ground Health. Early on in the pandemic, we worked side by side with individuals at the Monroe County Department of Public Health to help them track COVID-19 cases and hospitalizations and understand the scope of the problem. This was done in order to provide rapid, accurate, and up-to-date information to the community, including the number of cases and number of deaths as shown on the Monroe County dashboard. We also collected and analyzed data to help understand which populations, like nursing home residents, were most at risk. Here's an example of how we did this, creating and publishing on the Monroe County Department of Public Health website, age-adjusted infection and hospitalization rates due to COVID-19, again, helping to highlight which populations were most at risk, in this case, Black and Latino individuals. Finally, the center provided data and leadership to nursing homes in the region. Early on, we identified an increase in cases among nursing home residents and staff, helping to prepare the nursing homes for what was to come. We contributed data to the regional nursing home COVID-19 task force and helped the nursing home medical directors understand and track transmission of COVID-19 in the community and within their facilities to better understand what prevention measures needed to be taken. Here are some examples of the kind of data we provided. This graph shows the correlation between COVID-19 rates in the community, shown by the blue line, as compared to rates in nursing home residents, shown in red, and assisted living facility residents, shown in green. You can see that as cases spiked in the community, they unfortunately also spiked in the facilities, likely due to the introduction of disease from community dwelling members, such as facility staff members, contractors, and families. Similarly, this slide shows the correlation between the number of COVID-19 cases among nursing home residents, shown in blue, and staff members, shown in orange. And you can see that as transmission increased in staff members, it also increased in the residents. So where are we now? The center is continuing to track data locally and contribute to CDC's national statistics. To date, we have data on over 9,000 COVID-19 associated hospitalizations in our region. In Monroe County, there's been 79,845 total cases and more than 1,400 deaths. We're still averaging about 200 new COVID-19 cases a day in Monroe County, so there's clearly more work to be done in terms of tackling the pandemic. At this time, approximately 67% of the population of the county are fully vaccinated. The most important thing you can do to protect yourself and those you love from COVID-19 is to get vaccinated if you aren't already. Here's a list of the current vaccination clinics run by Monroe County. They're all offering first and second doses of vaccine free of charge, as well as boosters for those that may be eligible. All of the clinics take walk-ins, so no appointments are necessary. And there's a website at the bottom of the slide where you can find more information and an up-to-date listing of clinics. Besides vaccination, it's important that we continue to practice the same public health prevention measures that have been in place since the beginning of the pandemic. This includes things like washing your hands frequently and thoroughly, maintaining 6 feet of distance from others when needed, staying home from school and work if you're sick, avoiding touching your face, coughing and sneezing into your elbow instead of into your hands, and wearing a mask that covers your nose and mouth in crowded indoor settings. Thank you very much for your time.